girl gang, it's Dr. Joy here, and you are watching Delivering Joy MD. So this is part of our Super Mama series, and we're talking about how to do the postpartum period like a pro, part 2. We're going to be talking about some important things that we should know whether you had a vaginal delivery or a C-section, and some of the changes that we go through just having a baby period, like being pregnant and giving birth. Make sure you keep watching. So the first thing I want to talk to you about is vaginal tears. So I totally cringe whenever I think about vaginal tears, and I'm sure you do too. The one thing that I really want to convey to you is that they usually heal well. The vagina is very forgiving. And so as long as vaginal tears were properly repaired and put back together, they should heal completely. A lot of women have a lot of anxiety about how many stitches are down there or what happened down there. So in terms of the types of vaginal tears you can get, there are lots of them. They can occur anywhere from around the urethra, the hole we urinate out of, to the labia, the lips of the vagina, and what's called the perineal area, which is the area between the vagina and the anus. And they can also occur on the cervix and inside the vagina as well. So it's really important that we do a good thorough exam and make sure that once your baby has delivered that there are no tears, and if there are tears, they need to be repaired. We use an absorbable or dissolvable stitch to repair them. So it's very infrequent that we actually have to take any stitches out or remove those. We do not put staples in the vagina. That's a question that people have asked me before. So you should have an absorbable or dissolvable suture that should go away. Every now and then, the knot that we tie to hold everything together can take a long time to dissolve, and so some doctors may clip that. It usually doesn't hurt, but just so that kind of brings down that whole anxiety thing about having stitches in the vagina. Another thing, we rarely count how many stitches we do, but I get that question every time if I have to do stitches. It is really good to take warm baths with Epsom salt or sitz baths. Most hospitals have these available in some way, shape, or form, and that really helps to take the sting out of that area where you had a tear. We have sprays and things to help numb that area, and I really tell my patients, like, if you've had a tear, you want to make sure that you are patting everything dry when you go to the restroom, and also that you're not getting constipated. So those are two big things that I really focus on, is being very careful and cleaning that area. We often use a spray bottle versus washcloths and that sort of thing, and making sure that you don't get constipated so that you don't have to push or strain against that area where you had a tear. In terms of types of tears, you can have a first-degree tear, a second-degree tear, a third-degree tear, and a fourth-degree tear. So I want to go over these not for the purpose of like driving your anxiety up, but more so for the purpose of you understanding the depth to which you had a perineal tear and what it may mean for you. So women who have first and second degree tears are usually going to do quite well and not have any long-lasting effects from having a tear, and that tear can easily be repaired. Women who have third and fourth degree tears, however, may have some long-lasting issues, and some of these issues can be pain at the perineal site, pain with sexual intercourse, not having really good control of their vaginal and anal muscles, because in a fourth degree laceration and in a third degree laceration, it means that we have had a tear through the vagina and through the muscles between the vagina and anus. And in a fourth degree especially, we have a tear from the vagina going all the way into the rectum. Really important, if you have sustained a third to fourth degree laceration, that you're having frequent examinations to make sure that things are healing well, because we need all those muscles to heal back normally, and we want to try to make sure that you're also not experiencing pain at the perineal site. And so for my mamas, We rarely ever have third and fourth degree lacerations. I'm a big proponent of perineal support, so that when that baby's head is coming out, we're not just letting it pop out and tear the skin and the tissue and the muscles there. So I rarely ever have third or fourth degrees. But if I have a mom that that maybe has a third or fourth degree, I also think it's very important to do some pelvic floor therapy. Pelvic floor therapy can be helpful for any mom who has delivered a baby, whether vaginal or C-section, because even just the weight of carrying the baby on the pelvic floor muscles can sometimes make them weak. So pelvic floor therapy, definitely for third and fourth degree laceration, and also for any mom who feels like she needs to work on her pelvic floor muscles, which really is all of us. So the next item up for bids is C-section incision care. So with your C-section incision, this has been closed in multiple layers, okay? So you have multiple layers of suture. You may begin to feel a tightening sensation in that area, or some women say they experience complete numbness in that area. Both are completely normal, and you are hopefully getting all dissolvable stitches when you have a C-section. For me, if you're my patient, then you're getting dissolvable skin sutures as well. I do not use staples. But a C-section could be closed with dissolvable sutures under the skin or with staples. I recommend that you request dissolvable sutures under the skin. Actually, it has been proven that dissolvable sutures decrease your risk of having a skin infection in your incision by 12%. So you can ask for that. It's nothing wrong with saying, hey, could you close me with dissolvable sutures versus staples? And that area is going to be tender for a while, because when we go to actually get the baby out, we are going through layers of muscle, the tight tissue that kind of holds your muscle together called the fascia, and we are cutting through the uterus. So there's a lot of healing that has to take place on all of those different levels and in all of those different layers. So be gentle with yourself, be compassionate with yourself. You don't want to do a lot of heavy lifting after you've had a C-section. I always tell my patients, don't lift anything heavier than the baby after they've had their C-section. So, I mean, if you have had a belly birth, you deserve the royal treatment. Everyone else can do those difficult things for you. So make sure you really engage your support team, your friends, your family members, your in-laws, all the folks who can help out with things like housework and taking care of the other kids, because you really need to treat your body gently. I think that if you have birthed a human being, whether it's through a vaginal birth or a belly birth, you deserve some TLC from your friends and family. So make a plan, as we've discussed in previous videos, of how you're going to engage your support network so that you get the rest and the bonding time and the healing time that you need. In other countries, do you know that most women have someone who comes and moves in with them, whether it's their mother-in-law or their mother or a close family member, who actually helps take care of them for like a month? And I really wish that we were a little bit more intentional about that here in the US. I do know lots of moms and aunts and sisters and cousins come by and try to help out, but we don't really make a plan for that. Like, it's not really necessarily a mandatory or expected thing the way that it is in some other countries. In addition, in many other countries, there are also nurses and midwives who come and do home visits to check on postpartum moms, and we don't have that routinely in this country. There are some home visitation programs, and if you happen to have birthed your baby at home and you have a certified professional midwife, then they do home visits. But it can be really difficult when you get home, especially if you had a vaginal tear or a cesarean delivery. So we want to just make sure that you are engaging your support network to the very best of your ability so that you rest, relax, and recover. So the third and final thing that I wanted to talk about is what happens to us hormonally. So when we're getting home and in those first few days, there is a huge drop in our hormone levels, our estrogen and our progesterone. This can deregulate the chemicals in our brain that control our mood. And so for the first 2 weeks postpartum, many women, more than half of women, experience what are called postpartum blues. And that is just where you may experience crying spells, you may feel sad for no reason at all, and you're just kind of like, what has happened to me? In addition, there is usually a lot of sleep deprivation going on if you're trying to get on a feeding schedule and on a sleeping schedule with your babies. A lot of babies are nocturnal, meaning they like to stay up late at night when you're used to being asleep. So just the overall hormonal imbalance, the sleep deprivation, the huge life changes is enough to just be very difficult to handle. So if you're having difficulty with that, make sure you speak up. Postpartum blues should not last longer than 2 to 3 weeks. If you find that it has been 2 to 3 weeks since you had your baby and you're still having crying spells, you're still feeling sad, you're still having a lot of negative self-talk, saying that you're a bad mom or that you can't catch on to this like everyone else is, that's something that you want to raise your hand about. That can signal postpartum depression. And recently, we have learned that postpartum depression can start anywhere in the first year after delivery and may last up to 3 years. So if you're experiencing this, make sure you speak up, raise your hand, talk to your OB provider or your family doctor or even your pediatrician about how you're feeling. And of course, if you feel that there's an emergency, if you think that you would be better off if you weren't here, or your baby would be better off if you weren't here, or you're having suicidal thoughts or thoughts of harming your baby, you need to get help quick. Go to the emergency room, call your doctor, make sure that you get the help you need. Psychosis is very rare in postpartum moms, but depression is actually quite common. 1 in 4 women are going to experience postpartum depression, and 1 in 2 women will experience postpartum blues. So if you have been down for more than 2 to 3 weeks, it's time for you to seek help, because that can indicate postpartum depression, and that needs to be treated with counseling or medication or both. So make sure that you're raising your hand about that. So I hope today's video was helpful in talking about the physical and emotional recovery that we need. Tune in for our final video in this series to talk about how to get organized, mama. So give this video a thumbs up if it was helpful, and make sure you share with your friends who are pregnant or who have recently had a baby. If you've got questions or comments, post those down in the comments below. And I'll catch you next time, girl gang. Peace.